talking about arthritis. So when we look at arthritis, the overarching summary of arthritis is osteoarthritis, and a lot of signs and symptoms that surrounds with oh, no worries, William. Thank you very much for letting me know. We can put a lot of emojis onto the chat. That will be good also. Right. There's a lot of swelling that happens, and the science behind this is because that there is this fluid that's in between our joints or in between our bones, okay, kind of wear off with wear and tear, and then causing our bones to, kind of grinding to each other, and also causing growth to happen around the bones. And these can cause inflammation to happen, especially in the knees, hips, spines, and our hands. These are not limited, but there are also other areas of the bones that can occur. So rheumatoid arthritis, which I'll go later on, because there's quite a difference between both osteoarthritis and rheumatoid arthritis, RA. There is a distinct difference between them. So let me first ask you this question, right? So I'm going to launch the very first poll. Okay, do you think that arthritis only happens with old age, right? So the poll is going to pop up onto your screen, and you can answer what you think is the truth, what you think is the answer. So is it a myth or a fact, right? So all of you seem to be really expert at arthritis at this point. Right, so a lot of you are answering. 95% is choosing a myth. Okay, there's a couple of people are choosing fact. Okay, so there's no wrong or right answer. We're all here to learn. Okay, so no matter what your answer is, I wouldn't know who anyway. Okay, I'm just going to give it a couple more seconds for more people. I do see some people coming in. Hello, Roslyn. Okay, welcome. Okay, not to worry, you just didn't miss much. Okay, we're just about to start. Okay, so I'm just going to end the poll right here. Thank you very much for participating in the poll. If you missed it, not to worry, we'll have more to come. Okay, so let me share the results. A lot of you are choosing myth, and that is correct. Okay, it is a myth, because arthritis, although it's known as a degeneration condition, but it's not only happening with age. There are also genetics that play a big part, also, or trauma that happens around the bone area. So the most common two types of arthritis is osteoarthritis, which is the overarching one, and what we call as rheumatoid arthritis. Although they sound the same, but they're distinctly different. So osteoarthritis, usually there is no swelling. And the main difference between the two, some of the most classic symptoms is that osteoarthritis, individuals tend to feel 1 hour during the morning at less than 1 hour of stiffness. However, for rheumatoid arthritis, they tend to feel more than 1 hour of stiffness, especially in the morning. And with osteoarthritis, there are tendency of not having any swelling at all. And this can be due to wear and tear of the joint area, the cartilage, and then causing a lot of pain and restricted movement because of the pain itself. Whereas for rheumatoid, there can be inflamed and swollen areas, which can cause a growth in the bone area and causing cartilage to actually be destroyed further. And that also can restrict movement. So if we are thinking that we might have osteoarthritis or rheumatoid, it is good to check in with a doctor, because no pain should be bad long. So we need to know how are we feeling. It's good to see if there are swellings or redness that's happening around the joint areas. And sometimes these, if we're detected early, can be treated. Whereas we also can find ways to ease this discomfort and also reduce those pains further. So there are risk factors to arthritis. Okay, it very likely sometimes could be genetic, and also one of the predisposers is actually our age. So as we grow older, our bones and our cartilages, the fluids around the cartilages also can be reduced. There is a predisposition of female and male. Okay, women tend to be on a higher risk of osteoarthritis as well. Right. So one of the first behavior or lifestyle change that can help to ease the discomfort is actually to reduce our weight. So individuals who are in the higher BMI are recommended to reduce, because any weight that is on our joint area can cause more discomfort or pain.